Good afternoon, all viewers. I'm Dr. Syed Mustafa Ashraf. I'm consultant physician in charge Department of General Medicine at Prathima Hospital, Kachiguda. Today, there is a very special topic which I'll be discussing with you all. The topic is, as we know, the month of Ramazan, that is the fasting phase of Ramazan, is going to start very soon. So, based on that, many of people who are suffering from other diseases like diabetes or hypertension have so many questions and queries about how shall they go proceed towards this thing. So, for that thing and a few myths and facts during fasting, which I would like to discuss today. So, before starting, a brief background of the month of Ramazan, which is going to start. So, as everyone knows, we all know that Ramazan is a month where fasting is made compulsory for all the Muslims across the globe, and being most important pillar of one of the principles of Islam, fasting has been mandatory for all the adults during the period of Ramazan. So, what happens in Ramazan? How does a person who is observing a fast does? So, there are two phases. That is, one is called suhoor, the time, early morning time, that is somewhere around 3 to 4:30, where a person is allowed to eat, that is the morning, instead of his breakfast, because he will be starting the fast. That is the eating phase. And the opening of the fast, which is called iftar, that will be somewhere around evening time, 6:30 or quarter to 7. And during this whole time, in the time between suhoor and iftar, the person will not be eating nor drinking anything. So, this is how fasting is observed in the month of Ramazan. So, coming to our medical perspective, what experts give their opinion about fasting in special population, that is people who are suffering from chronic illnesses like diabetes, hypertension, chronic kidney disease and other diseases as well. So, coming to diabetes, Ramazan fasting is usually not recommended for patients who are suffering from type 1 diabetes, as type 1 diabetes is more ketotic prone. That means any skip of the meals or any kind of fasting might lead to further complications. Henceforth, the religious leaders have asked that those set of population can be exempted from fasting. Coming to type 2 diabetes, there were many questions from patients asking whether fasting is permitted, can they keep on in medical perspective, that can they fast, how safe it would be, or do they have to change their medicines, what needs to be done. For fasting, type 2 diabetic patients who are on tablets, that is oral hypoglycemic agents, can definitely fast, and they need to undergo few treatment changes. That is, suppose a patient who is on sulfonylureas needs to be the dose to be tapered during the opening of the fast rather than taking in the morning, whereas the other class of diabetic drugs like DPP-4 inhibitors, like SGLT2 inhibitors and other class of drugs can be safely taken during the suhoor time, that is the morning eating phase time. So, this approach, because you need to consult your physician before, if you are planning for a fasting plan during the Ramazan and you have diabetes and what needs to be done so that you don't land up in complication. As you know, people who are diabetic patients, type 2 diabetic patients who are on oral hypoglycemic agents have, during some part of the day tend to develop hypoglycemia, that is low levels of sugar, because of not eating their food on time. So in such situations, particularly in the fasting state, there needs to be change in the total treatment plan. And during that, after the physician advises you what treatment needs to be changed, and get your treatment customized in such a way that fasting should be made without any complication, and so that you can observe fast for the holy month of Ramazan. Coming to patients who are on antihypertensive, that is patients who are suffering from high blood pressure, they are on using tablets, and what needs to be done for them. For them, it would be better if they take their BP medications during the early morning phase, that is before starting the fast. They can take those antihypertensive medicines, and they can continue the fasting in a very safe way. And one more recommendation would be not to take extra salt in their diet, rather minimize their salt content in their diet, as taking regular salt in fasting state might induce thirst, and lot of thirst might cause a lot of inconvenience for you during if you are fasting. So this is a few approaches which needs to be changed. So what are all the dietary modifications, and what would be a very good form of diet for both of these patients who are suffering from diabetes and hypertension, so that all through the day you are at ease without any inconvenience during the fasting. So ideal would be a well balanced diet during the suhoor time, that is the morning time. So that should include somewhere around 40 to 50% of proteins and 20 to 30% of lipids, and the rest would be carbohydrates, because proteins and lipids, that is the fat content, they stay in the stomach for a long time, as they are complex diet, and it will take some time for it to get digested. Henceforth, providing energy to your body as well, and they keep your satiety level at the comfort zone, and simultaneously will not cause any inconvenience to you during the fasting state. And so you need to avoid sugar beverages, juices, and any other kinds of carbohydrates which gets digested easily, and later during the fast you might feel a little bit hypoglycemic or low sugars. So there are three phases that usually happen for a normal human being who fast for the whole month of Ramazan. During the first week of fasting, there are few physiological changes. This I am referring to normal people who observe. So initial first week, people tend to feel more sleepier and more kind of tiredness or fatigue. Few might experience headaches, and few might experience lot of sleep. This is due to the change in the lifestyle, that is they are not eating anything in the day, not drinking anything in the day, but rather in the evening or in the early morning. So the body metabolism changes and resets itself, so that the brain, which is usually habituated in getting regular carbohydrates and other energy deriving sources, that becomes a bit slower, and because of that they tend to become sleepy. They might be increased in sleeping, they might feel a bit dull. Fatigue, that is due to the water content in your body, becomes on a lower side, not causing that significant amount of inconvenience. And the benefits start to reflect. This might continue for first 2 to 3 days. Few might experience constipation, few might experience normal bowel movement, few might experience loose stools as well, but majority of that, within 3 to 4 days, all these symptoms drastically come down, and the person who is fasting starts to feel much better, and now the body starts getting adapted to the fasting state. It's a beautiful exercise actually. When one fasts during the time, each and every organ starts to detoxify itself, right from your head to toe. Every system gets cleansed. There is antioxidants produced in the body, the counteracting enzymes which inhibit several uh, toxic chemicals, and free radical mediated injuries are prevented. Thereby, the repair mechanism, the tissue repair mechanism in the body starts to begin faster, and the metabolism is resetted, and again it is brought into a proper position. And thereby, after the first 10 days of fasting cycle, now the person starts to feel more confident and more active while fasting without causing any problem. And thereby, the second 10-day period, that is the from 11th to 20th day, there are further better changes. The digestion gets improved. There are the hyperacidity phase starts to come down. The bowel gets regulated normally. The sleep pattern gets normal, and the hunger balance, the feeling of satiety and hunger balance gets normalized. So there are many benefits, and there are lot of benefits rather than any drawbacks or any kind of inconveniences during the fasting period, and rather it is more encouraged, particularly for obese individuals as well, who are planning to lose weight also, so that they follow a proper diet plan, where everything is balanced. While opening fast, it is usually it has become a more common thing that the opening of the fast usually comprises of a very few things, that is few dates, water and some fruits. That should be your ideal portion. And after that, once you open the fast, the dinner follows somewhere around after 1 hour or 1.5 hours. Rather, many of the people, what they do is they try and eat more during opening the fast. This will cause significant harm to your body, because once you take a lot of carbohydrates or lot of lipids or lot of protein rich stuff, the digestive system is not really prepared to take that much heavy amount of diet, and might further cause digestive problem and further weight gain. So there is a discipline to be followed in terms of diet. The opening of the fast should be very brief, except for few dates, as date contains a lot of calcium, iron and other minerals as well, and simultaneously good amount of water and fresh fruits that will quench the thirst and hydrate yourself and give good amount of energy, so that after an hour, when you sit down to eat, your digestive system is now ready to digest, and you can eat the dinner in a proper way. Not over eating is never recommended during this phase. So if these steps are followed on a regular basis, you might experience a great endurance level. The endurance level of every individual varies from person to person. So if you really want your immunity status to improve and the endurance levels in your body to improve, so you need to be very cautious on what you are eating, and not what everything is present needs to be eaten. No, that is not the case. If you are doing the opposite way, you are rather damaging your body more rather than deriving benefit from a fasting. And coming to other special situations, where patients are suffering from chronic diseases like liver diseases or kidney diseases or brain related issues or cardiac patients, these patients are exempted from observing their fast. However, if they they are really willing to fast, there are some important points. As said, the patients who are suffering from chronic kidney disease needs proper water restriction. That is, they are allowed to restrict the water. Patients who are on dialysis needs less than 1.5 liter per day, and who are not on dialysis need less than 2 liters per day. Simultaneously, cardiac patients who are suffering from heart failure are exempted from fasting. But if they really want to fast, or if they are bedridden or they are not active, so they can restrict their fluid levels, reduce their salt content in the diet, and can observe. And patients who are suffering from CNS diseases are really exempted. They don't have any compulsions. Pregnant women are exempted. Extreme elderly citizens who really have problem in performing day-to-day activities are also exempted. And the category of people who really fall in line with the fasting category, those who are fit for fasting and they eligible for fasting, they need to follow a proper diet plan. So that this is the ideal time where type 2 diabetic patients, hypertensive patients have a very good and bright chance of understanding their metabolism and bringing down their sugar levels and losing body weight simultaneously, so that after the fasting month gets over, they can continue that similar eating style by maintaining the diet all through the day, and thereby the requirement of the medications can come down significantly. So coming to few myths and facts about Ramazan, most of the people say that you might get weak, you might get a lot of hunger, and you might get a lot of thirst, which might be doing a lot of problem in your body. You might feel the headaches. Those are the early signs. As I've mentioned, the body tries to adapt. In 3 to 4 days, all these things disappear, and it is a beautiful exercise to detoxify your body. That is, the body starts to use the reserves. For suppose a patient who is suffering from high level of lipids, so who usually whose intake of fats and lipids is very high, and they're bound to use statins, the cholesterol lowering medications. Now in this month, if they really cut down the fat content in their diet and follow the proper fast, they have a good chance of reducing their cholesterol levels, and simultaneously this might even help be beneficial in producing the beneficial cholesterol, that is the HDL cholesterol, in preventing further progression of atherosclerosis and coronary artery disease as self. And proper eating habits will definitely help more. And coming to the fact that fasting has been an excellent remedy for patients who are suffering from fatty liver disease, first stage and second stage, and patients who are suffering from acid peptic disorders, they have a very good chance of regularizing their gut and maintaining. And people who are smokers, who smoke, they have a very good chance of detoxifying their lungs. Patients who were previously on unnecessary medications, frequent pill poppers, they have a beautiful chance of getting rid of all those medications, and the muscle tone of your body starts to improve. Thereby there is an improvement in your memory, consciousness, and further the cellular level repair and tissue regeneration is greatly being found actively in state of fasting. So my humble advice to all my viewers, Ramazan is a very beautiful month. Holy month of Ramazan is coming, and during this holy month, rather than overeating and unnecessary stuffing of food, you can follow a proper balanced way of lifestyle in this discipline of fasting, so that you can get benefits both physically and spiritually. And at the end of month of Ramazan, hopefully you might the burden of the disease who are suffering from other diseases patients might get low, and the normal individuals who have a predisposition towards getting a disease like diabetes and hypertension can also be safeguarded. With this, I close my talk and wishing you a happy holy month of Ramazan and a good fasting level, so that everything is followed in terms what I have advised. Thank you so much. So we have few questions to attend. The first question is Ramadan fasting a good for health? I mean reducing weight and for obesity patients. Yes, Ramadan is a very good month. You have a good chance of reducing weight, as seen in a majority of the clinical trials which were conducted all across the globe, especially in West Asian countries. They were found that if with proper calorie balance, that is decrease in the calorie intake and simultaneously fasting in a proper way, has improved almost. There were reports patient losing in one subset 3 to 4 kgs in the month, and one subset reported 5 to 7 kg decrease in obese individuals with proper plan. Another question is Haleem really helpful for health, or it is harmful due to high protein intake? Haleem is an Iranian dish which was brought particularly in Hyderabad, because Hyderabad has a very rich cultural heritage. So Haleem is usually started for it is a very high energy, it has high energy value because it contains a lot of proteins. It is helpful, but I recommend particularly either you reserve Haleem as a whole portion for the dinner and don't add anything with the dinner. This will help you, the load on your stomach will be greatly reduced, and you will be you can derive a good energy from Haleem. It's a good source of energy provided it is hygienic and you eat from a very proper derived source. One more question is certain diabetes can do fasting, I mean initial stage of diabetes patient. Yes, very much patients who are who have been diagnosed with early diabetes can safely fast. That is, it is not recommended during to take the tablet, that is one class of oral hypoglycemic tablet which is usually commonly recommended. They are not advised to take that tablet during the sahur state, that is in the morning phase, rather than take it after the opening of the fast. How about one day fasting? Is it good or not encouraging? Please suggest. See, there has been a concept of recently many trials been published about intermittent fasting in day-to-day lifestyle in reducing weight and other systemic diseases, and later it was found it was really beneficial. That is, the alternate day fasting concept was there, and the intermittent fasting, that is 18-hour fasting state and the rest few hours of eating phase, the eating phase being very brief and the rest will be only fasting. So that was found beneficial, and yes, I really encourage fasting to all the individuals, to all the subsets who are eligible for fasting, because it is rather very good for your metabolism inside, and to rejuvenate and improve the endurance inside your body, you need to have this month fasting state, so that it really cleanses your system. One more question is fasting can choose an option for reducing cholesterol levels, or increases the hunger? It's a good question. Yes, definitely fasting can reduce your cholesterol levels. provided you follow proper diet habits, avoiding fat content during opening of the fast, and it does not increases your hunger level. What happens is, initial first 4 to 5 days you might take time to adapt yourself, but after that it will not be any problem. You might not feel that much hungry, provided you eat good amount of diet during the eating phase, that is the suhoor time, early morning time. Another question is, someone's friend has a chronic health problem of kidneys. Is fasting recommended or it impacts the functionality? See, as I have discussed, patients who are not on dialysis and who are willing to fast, they have a limitation of restriction of body, the water levels, and simultaneously they need to take adequately. If they are willing, it will not cause any kind of disturbances, over disturbances, like sudden complications. But yes, if at all the creatinine levels are rising, dehydration might further lead to increase in creatinine levels. So that subset of population who are suffering from kidney disease are really exempted. It has been recommended not to fast. One more question is, let me know staying healthy and hydrated during Ramazan with fasting. Yes, I have discussed in the whole talk that avoid very spicy diet during the morning suhoor phase, because if you take more kind of spicy and more kind of salt content and more kind of complex diet, that it will induce thirst. As you know, spices induces thirst in every individual, and moreover the summer which we are going through is bound to create more dehydration. So a balanced diet which is light on your stomach and which has good caloric value, this is recommended. And a little portion, a small bowl of fruits is also recommended during the morning phase, so that the hydration aspect is also covered with that. One more question is, non-veg is suggested or vegetarian diet is helpful during Ramazan? See, it is not the question of vegetarian or non-veg, it is all about a balanced diet. So you can have non-veg and vegetarian diet in both phases, but either ways do not resort to more extremes, rather eating too less or eating too more, neither of which will help you out. And rather eating a balanced diet which should contain proteins as well, which can contain fat content as well, and carbohydrates in a proper balanced way. So this will help you staying active all through the day, so that you are not getting exhausted or fatigued, nor feeling weak, or not feeling excess thirst, causing a lot of inconvenience. You can continue with your day-to-day activity, observing a fast and simultaneously doing your activities. And be careful, my humble request to all the viewers who are planning to observe fast during the holy month of Ramazan, okay, not to overeat at the opening time of the fast, please. This is the only step which will help you in overcoming several diseases of yours. One more question is, guide how children can handle the fasting phase during these days. According to recommendations, Islamic prophetic traditions, a person who is eligible for fasting, that is, an adult is eligible to fast, that is, a boy or a girl who has attained the puberty are eligible to fast, so that they know when they feel hungry what to eat which gives them strength, and what not to eat, what to abstain from, and they know, they understand well that during the fasting phase neither they can eat nor drink anything. So for small children, that is, fasting is not recommended. For adults it is recommended. Any other questions? Yeah, one more question is, I hear that fasting for 30 days will help to end up in life-threatening health complications. It is true. See, as we are living in a very high-paced life, that is really fully urbanized, environment, the diseases most commonly what we see are lifestyle diseases. Type 2 diabetes is a lifestyle disease. Hypertension has now become a lifestyle disease. Obesity is a lifestyle disease. And other respiratory issues like allergic asthma or recurrent respiratory tract infections or problems with the stomach, that is hyperacidity and chronic constipation, these are all the things which are lifestyle induced, because of the urbanization. Either there are no proper eating techniques, or people don't understand the importance of diet as a medicine in their life. So definitely yes, with fasting, lifestyle diseases and their associated complications can, yes, drastically be reduced. And moreover, if you have, if you can overcome your extra cravings, the hunger pangs, if you can control them and prevent overeating, you are safeguarding almost 20 years of your life. If you can just follow, a 1 month proper fasting cycle. So many benefits can be derived, every time when you fast. So the 30-day cycle has its own science behind that, so that your lifestyle, get used to what you have fasted, what benefits you have derived, so that you can follow for that rest of the year in a properly balanced lifestyle. How to take care from raising temperatures during the Ramazan fasting at workplace? Yes, this is, as we all know, summer is now going to be at the peak, and with the holy month of Ramazan coming in the peak month of summer, what it is recommended, most of the people who work indoors, that is at their offices, stay in a cool, calm environment. Do not overexert yourself, or who have to go outside, rather than unnecessarily moving outside. Rather, you can stay indoors, do your work, and simultaneously, once you reach before the suhoor, there might be an ideal time for you to relax for half an hour or 1 hour, so that body get rejuvenated again, and you can wait till the opening of the fast. And during the summer time, I particularly recommend avoid spices, avoid sour things, and avoid lot of salt content in your diet, and avoid very deep fried and stored or canned food. These might do more harm to your body rather than giving you energy or providing you benefit. So freshly cooked food with less oil and lot of fruit juices during the opening time of the fast will be really helpful, and a gap of 1 hour should be mandatory at the time, since the time of opening of the fast till your dinner. More than 1 hour is always good and favorable, so that your body remains healthy. Another question is, please share a few tips for sunstroke prevention. As the most important golden rule is, during the summer times, normal individuals should, yes, drink 3 to 4 liters of water per day, be it any form, in form of juices, fruits, or normal water. Second thing is unnecessary going out in the opening sun, because now state will be observing a heat wave in the coming week. Almost it will be more than a week where temperatures are likely to soar above 40. So particularly young individuals and elderly individuals are bound to develop dehydration, and unnecessary going out in the sun, if you, unless and until it is important, staying indoors would be really helpful. And people who work on the field should at least cover their heads and their neck with some cloth, and so that the contact with the heat at at your scalp, at your neck and at your ears, the heat wave might increase your body temperatures to such a level that might induce sudden thirst and vomiting and severe headaches. So especially during the evening time, as we live in a very concrete rich areas, the heat from the buildings also might release. So sitting during the evening time saying that no, the sun has gone out, now we can sit. No, that now the heat from the buildings, from the surrounding walls also might affect you in a very negative way. So you need to wear very mild thin cloth, that is cotton rich, avoid polyester kind of dress material on you, and frequent consumption of water, and unnecessary moving out in the sun would be very helpful in preventing heat strokes. Coming to another question. So my conclusion would be, so holy month of Ramazan comes with many benefits, both spiritually and physically. So my humble request with, please derive both the benefits, both physically and spiritually, by proper uh, you know lifestyle modification, and observe the fast as it is said, as it has to be followed. The eating habits in the morning, and the opening of the disciplines of the opening of the fast, and simultaneously performing your regular work, and what things are required and are advised during the time of fasting should be done. And aim should be to overcome your cravings during the time of fast, will really make you stronger both from inside and outside. Thank you so much.